This is how you monitor for an adverse reaction to a transfusion. First, you would provide patient privacy by closing the patient curtain. You would perform hand hygiene and put on your gloves. You would verify the correct patient using 2 identifiers. That would be their name, date of birth. If they're nonverbal, it would be their name and their medical ID number. You would explain the procedure to the patient and ensure that they understand and agree to the treatment. You would remain with your patient for 15 minutes of a transfusion to assess for any reaction. You would monitor the patient for any shaking, chills, fever, shortness of breath, headache, and other signs and symptoms of a transfusion reaction. When a transfusion reaction is suspected, you should immediately stop the transfusion, take the patient's vital signs, and do not leave the patient alone. When the patient experiences symptoms other than a mild uricary reaction, remove the blood bag and tubing containing the blood product and replace it with sodium chloride and tubing, a sodium chloride bag and new tubing. You would notify their healthcare provider and either restart or disconnect the transfusion according to that provider's orders. You would then notify the blood bank that the patient had a transfusion reaction and return the remainder of the blood component and the attached blood tubing to the blood bank. You would obtain blood and urine samples per the practitioner's orders and your agency's policies. In the presence of the patient, labeled the specimen In the presence of your patient, label the specimen, prepare the specimen for transport, place the labeled specimen in a biohazard bag. When the specimen requires ice for transport, place the specimen in a biohazard bag, then place the bag with the specimen into a second biohazard bag filled with ice. Arrange for immediate transport of the specimen to the laboratory, administer prescribed medications, depending on the type and the severity of the reaction and according to the provider's orders. In the event of a cardiac arrest, initiate a cardiopulmonary resuscitation. Help the patient into a comfortable position, making sure everything is in reach, including the call light. To ensure patient safety, make sure that all of the necessary side rails are lowered, are raised, and lower the bed to the lowest position. Dispose of your supplies. Remove your gloves, perform hand hygiene, and document and report the patient's response and their expected outcome.